CDC says all U.S. hospitals should be prepared to treat more patients with the COVID-19 coronavirus. The agency has provided a checklist of equipment, testing, and training.
Joining us now is hospital CEO Dr. Josh Luke. He is a podcaster and best-selling author of Health Wealth for You. Good morning. Good to see you.
Good to see you as well.
There are a number of reports that hospitals across the country, they're scrambling to be ready for a rapid outbreak. So how well are Southern California hospitals doing in being prepared for something like that?
You know, I think our hospitals are as prepared as any hospitals in the country. There's really no organization beyond hospitals that's more prepared for this type of outbreak. It's not necessarily a pandemic in Southern California yet. I think it's important to remember, too, that a pandemic doesn't mean that it's deadly. It just means that it's spreading quickly. I think we hear a lot of people talking about overreaction. With hospitals, we're always prepared for this type of outbreak. Many people don't know, but we have actual containers outside of hospitals filled with garments, extra supplies, protective gear. We go through drills at least twice a year. I've been doing that for more than 15 years. As the CEO, I was out in the parking lot with the orange vest on, with the police chief, with the county EMS, twice a year for a half a day, really walking the walk. There wasn't any room to kind of fake your way through these drills.
Right.
And a lot of those were preparation for chemical warfare and things like that. So I would say the Southern California hospitals are very prepared. And most importantly, if you have a fever and you think you might need to be checked, it's most important to start with your doctor and not the hospital.
Okay. And to that point, if a patient comes in, how do they isolate that patient from others to make sure that other folks don't get infected and, and the care workers?
That's a great question, and I think that's part of the reason that going to your doctor first is important. In hospitals, we have policy and procedure to triage in place for overflow as well if there is a saturation issue. And so if an individual hospital invokes that, they'll have a policy so they triage patients who might have symptoms in different areas and separate them from those who might not be showing symptoms as well. So.
If there were to be a widespread outbreak where people feel the best thing to do would be to go to an emergency room, that can pose a major risk, right? And asking folks maybe to avoid that. What kind of advice would you give regarding that?
Yeah, again, you know, in my book, Health Wealth, I talk about the importance of becoming an EHC, an engaged healthcare consumer, and that was really written for two reasons: to help you save money, but also to help you get better access to care, because we're living in a day with a broken system. And I think when you think about becoming an EHC, an engaged healthcare consumer, right now is a great time to do that because you're going to get improved access to your doctor. There's something called direct primary care we spoke about last time I was here, which is a version of concierge medicine. And now is a really good time to consider saying, hey, I haven't had a personal family physician in years. I'm going to pick one in my market. I'm going to have a relationship with he or she. My family did that. It's $150 a month. And we walk in anytime, don't need an appointment. He spends about 20 minutes on average with us each time, which is a far cry from what it was in the 90s and after the millennium.
How do you know which hospitals are ready for you in this situation? Is there a way to, and should I be engaged in picking ones now so that I think, okay, if I have to go to a hospital, here's the one we're going to?
Yeah, I think there's two ways to do that. One is to tune in and watch you guys every morning to find out who, whether it's UCLA or whether you're in Orange County, who might be being given a little bit of the extra supplies to be more ready for a situation like this. But again, we keep going back to this same thing of call your doctor first, because the doctors are getting daily communication on which of the hospitals they go to. And remember, your private practice doctor is usually a family practitioner, primary care, but he or she works with an infectious disease doctor, and so they know which ID doctors go to each of the hospitals, and most ID doctors go to 3 or 4 hospitals at a minimum.
Thank you so much, Doctor, for being here this morning. Dr. Josh Luke is a hospital CEO and member of the USC Sol Price School of Public Policy. He's also a podcaster as well as best-selling author of Health Wealth for You. To learn more, you can check out his website. Thanks for coming in.
We have no idea how he has the time to do all those things.
I know, right?
It's good to have you. We do appreciate it.
My wife says the same.
Right.
Thank you so much.